I'm Christine Ortiz-Gamino with the National Environmental Health Association. Thank you for joining us today for the EPA Research on Environmental Cleanup and Disinfection of SARS-CoV-2 webinar. A little background on this webinar series. NEHA and the EPA have been partnering for the last 2 years, collaborating and promoting each other's work along with producing quarterly webinars. Today's webinar will be building a foundation of world-class research by applying EPA scientists' knowledge to reduce the risk of exposure to SARS-CoV-2, the virus that causes COVID-19. This research will help states and territories, tribes and local governments, including public health agencies, guide homeowners, businesses, and others to reduce the risk of exposure. This webinar will highlight research EPA is working on related to environmental cleanup and disinfection. A bit of housekeeping first. All webinar participants will be in listen-only mode. This webinar is being recorded and will be provided on the NEHA Preparedness webinar page. Additionally, EPA will share through their modes of media as well. There will be a Q&A at the end of the presentation. We will hold all questions until then. The Q&A will be conducted via the webinar chat box. Feel free to enter in any questions you have via the chat box throughout the webinar, and we will address them at the end of the presentation. I will now pass it to Bailey Stearns at EPA's Office of Science Communication and Engagement, who will introduce our speaker.
Hi everyone, my name is Bailey Stearns, and as Christine said, I'm a science communicator at EPA. Our presenter today is Dr. Sean Ryan. He's a chemical engineer for EPA, currently serving as the Director of the Homeland Security and Materials Management Division in the Office of Research and Development's Center for Environmental Solutions and Emergency Response. Dr. Ryan has over 19 years of experience at EPA, including 16 years leading research to support EPA's Homeland Security mission. His expertise includes process engineering, reaction kinetics, and environmental engineering, and his research at the EPA has focused on biological and chemical agent-related decontamination. I will now pass it off to Sean to begin his presentation.
All right, Bailey, can you hear me okay?
Yeah, we can hear you, Sean.
Oh, great. Okay, well, thanks for the opportunity to present today. I'm really excited to present on some of the research that we're doing related to trying to help the respond to the COVID-19 pandemic. So just to start off with a quick disclaimer that there's really no policy that'll be discussed or presented today, and this really does focus on a lot of the research that we're doing, and that any mention of any types of trade names is not really a recommendation or endorsement by EPA for use. So I'll start off today by presenting a set of short documents that the White House, EPA, and CDC had put together on reopening, or maybe it's better termed repopulating or reconstituting our public spaces, our workspaces, our businesses, our schools, our homes. And this set includes a one-page document that was intended as a general placard to talk about high-level recommendations on that front side of that placard, and a general cleaning and disinfection type decision tree on the back side of that placard. There's also an accompanying longer document that gets more into the details about those recommendations and how to really walk through that decision tree. And really a valuable piece of it is a lot of the links to other guidance that's out there from the EPA, from OSHA, from CDC, that provides some more specifics about specific areas. So this slide shows the front side of that placard. It breaks the process of cleaning and disinfection down into 3 phases, and that's develop your plan and what you need to do to develop your plan, and implement your plan, and some of the important points about implementing your plan, and then very important to maintain that plan and revise that plan as more guidance comes out or changes need to be made. So it really comes down to prepare it, do it, and review it. The back side of that placard talks through a decision tree that, again, is intended to provide a general framework for use in preparing your plan. It provides definitions of what cleaning and disinfection are at the top, really drawing out the distinction between the two terms, between what cleaning will do for you and what the added disinfection step does for you, and when one might be needed, when disinfection really might be needed in addition to cleaning. It then walks through some of these key questions to consider as you develop your cleaning and disinfection plans that are talked about on the front side of that placard. It also has the flow diagram to consider what you would do to implement your plans and also to maintain them plans. And we'll get into some of these questions in the next couple of slides. So developing your plan. And this covers determining what needs to be cleaned versus really what needs to be cleaned and disinfected. And it's important to keep those terms it's important to keep them together when we're talking about disinfection. Whenever we're using a disinfectant, it's important to make sure that the surface is pre-cleaned, that it's free of any visible dirt, and then the disinfectant can do its job that it's supposed to do. So the decision tree on this placard, as you can see, starts to ask the questions, is this an indoor or outdoor area? If it's an outdoor area, the thought here is that there are other processes in place, such as sunlight, and just a lot more conditions that really can promote the virus of dying off and less exposure to the virus. So for outdoor areas, the thought is really maintain your existing cleaning practices. When you get into indoor areas, it then comes down to whether that area has been occupied in the last 7 days. If it has, then there's consideration of cleaning and disinfecting of areas. If it hasn't, then there's a good chance, a very great chance, that there's already a considerable reduction in the amount of virus that's on any potential surfaces. That if the facility has been unoccupied and uncontaminated in the last 7 days, the virus is going to naturally die off, and general cleaning is really what's recommended, as well as any other considerations for building reopening, such as making sure your water system has been properly maintained, your air handling system has been properly maintained. So then the next question would be, okay, if we know that our facility does need some cleaning and disinfection, well, what surfaces do we need to focus on? And then what types of disinfectants do we use? And that comes down to thinking about how frequently our surfaces touched, especially touched by different people, and thinking about trying to reduce the potential contamination from one person touching it to the next person touching it, and ways to do that. So that's with cleaning and disinfection, but it's also with maybe trying to minimize the actual touching of or sharing of objects as well. When it comes down to the actual surface types, it's really important to consider whether that surface or material or object is hard and non-porous versus soft and porous. And there's different disinfectants that are useful against those different types of materials. EPA's List N on the EPA website, which the link is there, really walks through the 400 plus different disinfectants that are approved by EPA for use against SARS-CoV-2. And they're listed there with the types of surfaces that they're useful against, whether they're useful against a hard and non-porous surfaces like metal and glass and hard plastics, or whether they're for use against more soft and porous materials like your fabrics or carpets or any other types of materials like that.
Hi, Sean, not to interrupt you real quick, but can you put the presentation on full screen? Your taskbar at the bottom is cutting some of the presentation.
Oh, I see. It is, but the taskbar won't minimize. Let me just get rid of the taskbar. Unfortunately, I don't know why I have an issue on this computer of the taskbar will not minimize. It just stays. I'm sorry. Hopefully it'll fix itself in the next couple of slides. Maybe that might be the only slide where it's impacting. Is that true?
I think it's not as noticeable in some of the other slides.
Yeah, hopefully it will. For some reason there's an issue with this computer that I can't figure out why it doesn't minimize on its own. I'm sorry.
No worries.
All right, so if we get back into implementing the plan, and this is one of the slides I know that it's being cut off. So it's important to consider cleaning with soap and water, and that's going to remove germs, dirt, and impurities from surfaces. That's an important step prior to disinfecting. Disinfecting, it should use an EPA-approved disinfectant that's approved against COVID-19 virus, and the website that's partially cut off there is the website to go to get the list of disinfectants. And it's really important to follow the label, to follow the safety requirements. That's probably going to be at minimum wearing gloves. It could be additional safety requirements based on a product that's being used. As I mentioned, it's important to clean prior to disinfecting, and then consider applying the product appropriately, meaning what types of materials does it say it's useful for. And most of the time, right on the back on the label, it'll say this is used for hard non-porous surfaces, this is used for tile. The material is important to consider there. And then the application time. So how long do you need to keep it wetted for? How long do you spray it? How far away from the surface do you spray it? All those are critical factors when to effectively use a disinfectant and effectively use the right disinfectant. It's then also very important to maintain your cleaning and disinfection practices. And so the biggest question that the group wrestled with in developing these recommendations is, what is frequent? What is frequent enough for cleaning? And so that really comes down to, well, how often is that surface or object going to be touched and then reused by someone else? And so it's really no, magic word of how frequent is frequent enough. It's really considering how these objects are used and then devising your plan to consider how to disinfect them between uses by different people. And there could be other ways too. There could be other safe practices that could be followed, such as removing or reducing the need to touch frequently. We need to touch objects that are shared between people. Also continuing to emphasize hand washing and using cloth face coverings and staying home when you're sick. Continuing the social distancing, if it's a restaurant, moving tables or work areas, moving workstations so that social distancing can be maintained. And then also soft and porous materials. I did mention that there are disinfectants for them. Of the 400 plus disinfectants on EPA's list, then over the majority of them, maybe all but 7 or so, are for use against hard non-porous surfaces. It's a lot easier to clean hard and disinfect hard non-porous surfaces than it is for soft and porous surfaces. So if there's ways to reduce, cushy chairs and things like that are going to be shared, it's probably better to do that than try to disinfect them, because again, there's minimal things that are really useful. So with that, there's obviously a lot known, as you can tell from the guidance. We did put guidance out together with the White House, with EPA, and with CDC, based on what we do know. And EPA has a robust set of capabilities to deal with environmental challenges. Dealing with the risk of exposure to SARS-CoV-2 due to contamination in our everyday environment really falls within the capabilities that we do have within EPA. This includes approving appropriate disinfectants and proving that they do work against SARS-CoV-2. This includes other ways that EPA knows and has provided capabilities on in the past to reduce the risk of exposure to contaminants in our environment. But at the same time, we and the world continue to learn a lot more about COVID-19, and we continue to want to develop improvements in our understanding of ways to reduce the spread of the virus and how that we can monitor for the spread of the virus in ways that we can understand that our solutions that we're implementing, such as in that previous guidance, are actually effective. So within ORD, within EPA's Office of Research and Development, we're utilizing our expertise that we've gained over the years working on biological, chemical, radiological contaminants, and other research capabilities to really address some of the challenges in response to COVID-19. We're working together with our federal partners, with CDC, with DHS, with state and local, territorial and tribal stakeholders to really understand what the needs are, what's out there that might be potential solutions, and then how those solutions can be really brought forward for an effective approach to dealing with COVID-19 and eliminating or minimizing its spread. So we're conducting applied research to address gaps and improve capabilities for disinfection, especially if we consider disinfecting real world materials. You know, not everything is made of stainless steel and glass. There's things like you see there in that picture, the elevator handrail. Well, that's kind of hard. It's kind of non-porous, but it's certainly not the same and going to act the same as a stainless steel. So how do disinfectants work on these real world type materials like that? How can disinfectants be delivered appropriately or easily? So there's a lot of interest in being able to spray or apply disinfectants over larger areas in an easier way, like with something like a fogger or an electrostatic sprayer. You can think about, I think the picture there looks like it's in an airplane. You can think about trying to take a trigger spray bottle, which you might find in the grocery store, and trying to use a trigger spray to spray every surface in just that aircraft. Things like what you see there, electrostatic sprayers can use a lot less disinfectant. They don't completely saturate a surface, but they can get it wetted. But questions come back down to, well, is that effective? It might be an easier way to apply it, but does delivering less disinfectant, does it still keep the surface wetted for that contact time that's on the label? And so those are some of the questions we're trying to address. There's also questions about environmental sampling methods, whether that's in sewage or on surfaces, and what can that tell us, both in terms of monitoring the outbreak, but also the effectiveness of our mitigation strategies. So, you know, just to reiterate some of these questions, I talked about real world surfaces and how they can be disinfected, but some of the other questions we're trying to address, are there ways that these high touch areas or surfaces within public, can they be disinfected in such that the disinfectant can have some residual property and maybe be have a residual disinfectant property for over a length of time? So you apply a coating or a product to a surface, and it can continue to kill the virus for days to weeks to months. There's a lot of products out there that that are claiming to have some of these capabilities, and we're trying to assess whether those capabilities really do exist in those products. There's also a lot of questions about PPE, and can PPE successfully be disinfected and then reused, especially PPE that's really not meant for that purpose of being reused. But in this time and with considerable shortages, there would obviously be an advantage if PPE can be disinfected successfully and reused. And then, can wastewater be used to monitor infection in our communities? There have been a lot of studies and a lot of interest in being able to detect the viral RNA or the signature of the virus in sewage, and then the potential to use that to look at communities that are currently impacted by COVID-19. So to get a little bit more in depth into what we're doing to address some of these questions, EPA and CDC recommend that frequently touched surfaces, especially those frequently touched surfaces that are touched by many different people, that they're disinfected often using EPA approved disinfectants. And as I mentioned, that disinfectant really needs to be, or should be, it needs to be suitable for the surface that you're using there, or that you're trying to disinfect. So while we have over 420 products that are approved against COVID-19, over 400 of them are for hard non-porous surfaces. And again, that comes down to mostly things like stainless steel or Formica countertops and things like that. When we get into these sort of what I would call in-between type materials, elevator handrails or latex painted surfaces, they're not exactly as hard and non-porous as you know the surfaces that you would see on the back of these labels. What products really work for them? What products work for the seat fabric in your local buses or airplanes? And so that's what we're trying to address in this study. Are there products that are registered against SARS-CoV-2 that are maybe useful, or that are widely available and maybe useful for hard non-porous surfaces? How well do they work on these other type materials, things that are, again, those in-betweeners or even those soft fabrics? And so we're trying to assess that and provide some solutions for these types of surfaces. So with an understanding of which of these products might be appropriate to address your disinfection needs, really the next question comes down, how can we apply them appropriately? So it's important, as I mentioned before, it's really important to follow the manufacturer's label instructions, and that includes using your appropriate PPE. It includes making sure you apply it appropriately. If it says, spray it 4 to 6 inches from the surface, it's, spray it 4 to 6 inches from the surface. If it says to have that surface remain wetted for 10 minutes, 30 minutes, or 60 minutes, the surface really needs to remain wetted for that length of time. So the question then is, when we get to these types of sprayers like you see in the picture, how effective are they at delivering the product to the surface of whatever we're trying to disinfect, of making sure that surface stays wetted for the contact time it needs to be? And you can see that the droplets in there are probably much, much smaller than what you might get out of just your general trigger spray applicator for many disinfectants that you see on the shelf. So does that smaller droplet size, does that really impact the efficacy or the effectiveness of these products? These types of sprayers or foggers offer a lot of potential for applying products over large areas. There's a lot of interest in hotels being able to use them, or the airlines being able to use them, or subways being able to apply disinfectants over these large areas with such an application method. But it kind of falls into a little bit of a gap for EPA right now. There's only one product that's currently registered for use with these types of sprayers. So what EPA is really trying to, and what we're trying to help with here, is to assess whether these sprayers or foggers can be used with current registered disinfectants and can be used safely and effectively. And so the research we're doing is looking at different types of sprayers, different types of disinfectants, and trying to understand what conditions they can be effectively and safely used, and maybe what conditions that they really can't be. So this is kind of one of our bigger projects right now. It's one that's moving the fastest, and it came in as a real high priority. A lot of areas like metros, New York City is a great example. We're working very closely with them on this project. LA Metro is another great example that we're working closely with. A lot of these subways and other kind of transportation hubs where there's a lot of people going through, touching surfaces, and there's no way that anyone can come behind them, clean the surface before the next person touches it. So you can think about sitting on a seat that someone just sat on, how comfortable you're doing that, or grabbing a handrail that somebody just grabbed who got off the train just before you got on. So although New York, as an example, are really trying to improve and increase the how fast and how frequently they can clean and disinfect the trains and buses, if there was a solution such as a disinfectant that had residual properties, it would be really the game changer for them. It would enable these surfaces to, if they do get contaminated with virus, to inactivate or kill that virus on the surface without having to continually come back and do the cleaning and disinfection. So there's a lot of these coatings, they're typically called like microbiostats or antimicrobial coatings, that are out there. They're a lot of times used for odor control or stain control, stain resistant coatings. A lot of them are now coming out saying, yeah, hey, we stop the growth of bacteria and mold, and in addition to that, we also kill virus, especially SARS-CoV-2. None of them are registered with that kind of what you would call public health claim. None of them have a claim against viruses, but are claiming to maybe have some data or information that they can be useful against viruses. So that's where we're coming in. We're coming in to take a look at these coatings and look at them and see if they do kill a virus over a time after application to a surface. If they do that, how well do they hold up to normal use? Normal person coming in and touching the surface, is that coating still intact enough to kill the virus if it does do that? Will it hold up to normal cleaning and disinfection? Will it hold up to normal weathering? And so those are the kind of questions that we're trying to address. This is a big one for us, in that if we can demonstrate things that do work, it could obviously have a huge impact on how things are cleaned and disinfected into the future. But I would say that, for right now, based on what we're seeing, it still is a big if. There's no, magic universal solution out there. Another area that's kind of a gray area for EPA and FDA is our devices. Devices such as things that are pesticide devices, if you will, that such as UV or ozone, that may be able to kill bacteria and viruses, and that are often used in healthcare settings. They kind of fall in this area of they need to be regulated by EPA, but they're not registered by EPA. And the same thing on the FDA side. So there's no verification right now of the actual efficacy of these types of devices. And so again, that's where we're coming in, where we're looking at how well do these devices do against SARS-CoV-2 on different surfaces, but a little bit more than that. It's, yes, UV can be very effective when it shines directly onto a surface, and that surface and any virus on that surface can get the dose that's necessary to kill the virus or inactivate the virus. It's very effective. However, when you try to get these devices into a more applied scenario, so think about shining UV lights everywhere in a subway car, the side of the seat, the back of the seat, underneath the handrail, the side of the handrail, all those different surfaces are going to see a different incident of light or UV light than the top of that handrail or the top of the seat. The distance matters. The orientation of the lights matter. And so in addition to understanding the efficacy or the dose required at different wavelengths to understand what the kill is for SARS-CoV-2, we're looking at the engineering side of it, or the applied side of it as well, to see how well these kind of lights do in those very applied settings. I mentioned the challenge with PPE. So what we're trying to take a look at here is high demand PPE, not just your N95 masks, but other things like gloves and gowns and face shields and maybe your everyday work outfits, are things that are not really meant to be disinfected over and over again. How well what types of disinfectants are easily, readily, widely available that can be used, and how can they be used in a way that they don't damage the PPE and the PPE can hold up to repeated use? So there are things that have been out there in the news. There's things like hydrogen peroxide vapor. There's some other types of devices that have been out there in the news. A lot of these devices are really specialized in that they can be costly to buy the equipment, or costly to send things off to be disinfected. So what we're looking at are ways for communities to have things that are readily and widely available to them, that can be easily used by on-site personnel for routine disinfection. Surface sampling is another area where we're highly engaged with CDC in. There are many challenges with efficiently and effectively collecting viruses from surfaces. There's challenges with getting the virus out of the sampling media after you take a wipe of a surface or a swab of a surface, and it does pick up any virus. There's challenges with then recovering that virus out of that sampling media. So there's, inefficiencies all along the way with viruses, from your initial collection to getting it out of the collection media to doing the overall analysis. Sampling for pathogens from surfaces, it's not very sensitive. It can have very high detection limits, meaning that not detecting virus does not necessarily mean that the surface is clean. It can require several days or weeks for the analysis to confirm whether or not the virus is actually still infective. A lot of the results that have been publicized out there, from whether it was Diamond Princess or hospital rooms, a lot of times they're just reporting RNA, detection of RNA. So they're saying that the virus remnants of the virus are there. It doesn't tell you whether that virus on the surface is still an infective virus. In fact, most of the papers, when you see them, there'll be one line in that paper that says, we did not detect any infected virus in this study, although RNA is everywhere. So bottom line, sampling overall can be a challenge, and what it tells us, there's still a lot of uncertainty there. However, it could also be very useful if we can detect the virus on surfaces and the infectivity of that virus on surfaces. It can help us, especially coupled with epidemiological studies, to understand what areas, what surfaces might be problematic, or how well mitigation steps are really working to mitigate any potential surface contamination and exposure from different surfaces. So for that reason, we're trying to understand better what sampling efficiency is, what our detection limits would be, and what really sampling can tell us alongside of epidemiological studies. So in addition to sampling, part of the challenge with environmental sampling is actually the analysis of the environmental samples for the virus, which can also be problematic. So I mentioned about detection of RNA. So methods that do detect viral RNA do not directly inform the actual infectivity of the virus. These methods are often used because they can be very specific. They tell you which virus is there. They can be very rapid. They can be run in a few hours to a day for sample processing and analysis. But again, they have that drawback of indicating that the virus or remnants of that virus are there in terms of its RNA, but nothing in terms of whether that virus is still capable of being infectious. So the infectivity really requires infectivity analysis, usually with cell culture assays. They can take days to a week to run, and can be very time consuming. So to improve upon this capability, we're developing what's called rapid viability reverse transcriptase polymerase chain reaction, or RV-RT-PCR technique. We have history of developing this with the Department of Energy and Lawrence Livermore National Labs for anthrax, for Bacillus anthracis, looking at developing RV-PCR to support environmental sampling after BA Bacillus anthracis incident. So we're taking what we've learned from that, and adapting it for this virus to develop this RV-RT-PCR, where it can really help us to reduce this sample analysis time for environmental samples from that 4 to 7 day window, giving us both the selectivity and the infectivity information, down to a 2 to 3 day window for these samples, giving us that same information. So another area that's really been in the news lately has been detection of viral RNA in sewage. And so one of the things that we're doing within EPA is taking a look at the methods to be able to detect CoV-2 or SARS-CoV-2 RNA in sewage, and whether we can improve upon those methods, get some standardized methods to be able to start to compare data from different analyses across the country to understand what types and what levels of virus are in sewage. Right now, there has not been, kind of the same with the surface sampling, there has not been any actual infective virus isolated or detected in sewage. It's been just the RNA. But just that alone, just the detection of RNA in sewage might be a help here, because it can therefore tell you that the virus is prevalent in a community, or maybe when it's not detected is no longer prevalent in a community. So the work on the standard method factors directly into taking a look at being able to assess the use of this kind of methodology for a community assessment of infection and infection rate within communities. So if we can detect the virus or the viral RNA in sewage, it's one way to be able to understand whether a community has been infected or is currently infected with COVID-19. And so we're partnering with a number of municipalities, Cincinnati being one of them, to try to test out these methods that are being developed and a method for looking at community monitoring for SARS-CoV-2. This work is also being done in conjunction, or at least in coordination, with CDC and others within the community. And it's an area that's, again, been getting a lot of attention as a potential way to do some of this kind of overall community monitoring for the disease outbreak. So this was just a really quick overview. Hopefully it was an exciting quick overview, but a quick overview of the research that we have ongoing within EPA. We do have this website that you can see here. And if you don't have these slides handy, if you Google or Yahoo or Bing EPA COVID research, this is pretty much the top website that comes up. And you'll see information on all of the studies that I've presented on today, as well as the contact information for anyone associated with these studies, or the leads associated with these studies. And with that, I'd be happy to stop and take any questions.
Thank you, Sean, for that wonderful presentation and very timely presentation. Again, the webinar will be posted on NEHA's preparedness webinar page along with the slides within a week, and EPA will also share through their channels. So there are a lot of questions, so let me get started with a couple. What about the health hazards of applying disinfectants on everything, especially the use of electrostatic sprayers, where manufacturers are using videos to encourage spraying the disinfectant everywhere?
Yeah, it's a great question, right? And so one of the things that our Office of Pesticide Programs is worried about and are looking into is that safety issue with the electrostatic sprayers and the application of disinfectants. So first and foremost, we did talk a lot within EPA and CDC on the recommendation document about the widespread use of disinfectants. And really the recommendation is it's not that recommended. It's not the best use of your disinfectants to go and spray it everywhere, outdoors and things like that. It's really not the most effective use. But there are times in places where it can be useful, especially if you're thinking about the subway cars at each night, or whether it's the airplane, or whether it's a hotel room after someone leaves and new folks come in. There are areas, restaurants, there are areas where you do want disinfectants to be used appropriately. And so EPA absolutely is considering, whether these disinfectants are safe to be used. And then the same thing on the electrostatic sprayer side. It's not whether, just can it be used effectively, can it be used safely? And are those smaller droplets potentially hazardous to the applicator or anyone that maybe just comes in right after these disinfectants are applied? So it's absolutely something EPA is thinking about considering, and as part of approval of any disinfectants.
Next question. I understand the SOP is to clean the surface and then disinfect. But what if someone sneezes on a small pile of dirt on a surface? Isn't the contamination on top of the dirt and not under the dirt? So in this case, disinfect all the material, then you want to remove and clean the surface.
Yeah, another good question. And we go through this often because you have to recognize that when you're cleaning a surface, whether that's the dirt someone sneezed on top of that surface or whatever, that there's some risk there, right? And so I probably didn't mention this, and I should have right up front, is that when you're cleaning alone, you need to wear your appropriate PPE, and you need to assume that anything you're cleaning with is now contaminated. So there absolutely has to be appropriate training of staff that's doing cleaning and disinfecting to consider and understand that cleaning is essential, because the product, to be honest with you, the disinfectant product is not registered against that dirt, and that dirt and grime and things that are on the surfaces are what renders disinfectants oftentimes ineffective. So, although you might want to douse it and drench it with the disinfectant, there's a counter to that, and that whatever is on that surface, that, dirt and grime is gonna also eat up that disinfectant's active ingredient. So it is absolutely beneficial to remove any residual dirt, but considering that whatever you're removing, whether you're using a cloth, a sponge, a paper towel, whatever, that's waste that should be handled appropriately because it's probably contaminated waste.
Can EPA support the use of products not in the N list with or even more active ingredients in stating effectiveness against non-envelope virus such as H1N1 as the products that are on the N list?
So I'm not sure if I understand the question. Hopefully I do. So this is more of a question for our Office of Pesticide Programs, and again, a good one. There's a lot of guidance on the EPA's website for, if you go to that List N site, there's guidance on how to get registered and what it means to be registered against SARS-CoV-2. So typically what that means is that there's some related information against other types of coronaviruses. Or that the registrant will have data that demonstrates that they can kill SARS-CoV-2, and there's more of that coming out as we speak. So there is a pretty strict protocol and it's pretty strict data review as to what can be what will be ultimately registered or approved for use against SARS-CoV-2. If something is out there that says hey, it kills influenza, but it's not on List N, it can't, I can't stand here and recommend that. It should be something that's approved on List N, because that means that EPA has reviewed this information. There is a lot of products out there that are claiming to do something useful. And really, I would highly recommend going back to EPA's website and checking it out, before just believing or buying off on things that are out there.
All right. How do you surface disinfect hard to reach places? And how do you get innovative chemical disinfectants registered by EPA?
So the second one, can you repeat the second part of that real quick?
Sure. How do you get innovative chemical disinfectant registered by EPA?
So again, going to that List N link, so the one that was cut off, beat by my lovely taskbar. But if you, again, Google, Bing, Yahoo, EPA List N, going too far here, EPA List N, this website will come up. And I think it's on the left-hand side of this website, or somewhere right prominently on there, it'll say, how do you get products registered? And it walks you right through there. The first way to do it is by contacting EPA's Office of Pesticide Programs. That'll be the first step that you'll see on that website. Contact Office of Pesticide Programs and talk through, the product, have a consultation, talk through the product and what testing would be required in order to get your innovative product registered. Generally, what that means is that you're going to follow a standard protocol. There's ASTM standard protocols. There's an ASTM, what's called ASTM 1053. There's an ASTM 2197-17. Both of those protocols are standard protocols for virucidal testing or disinfectant testing against viruses. And really what it requires is that these products demonstrate that they can kill the virus that you're intending to register it against, with the specified application and contact time that you're saying would be on the label. So the first step, contact Office of Pesticide Programs, and there's a lot of information on the website. And now I forgot the other part of that question. Can you?
How do you disinfect hard to reach places?
Yeah. So, well, you got to get the disinfectant there, right? So hopefully, if it's a really hard to reach place, then there's maybe a less of a need to disinfectant, right? If it's a hard to reach place and you're not going to and it's not very likely that you're going to come in contact with it, or that it can even have been contaminated, the chances of it really needing to be disinfected probably go down quite a bit. Really, the guidance is to focus on surfaces that are frequently touched, and especially surfaces that are frequently touched by many different people. So bottom line, you got to get it there. That's one of the benefits of the electrostatic sprayer that we're looking into, is it can have an effect to get sort of hidden or more difficult to reach places.
What is one product that is currently approved to be used with an electrostatic sprayer?
The Clorox Total 360 product. It comes there's actually I think sold as a product, and also sold as a product with the electrostatic sprayer that is registered for use with.
I know you are looking for the virus in raw wastewater. Is the virus still viable and possibly available for workers to inhale, where the wastewater is aerosol in places like aeration tanks and final effluent re-aeration?
So currently there's been no viable, effective, whatever word you want to use for a virus, non-living virus. There's been no effective virus identified in raw sewage. So, that's the number one thing. There's RNA detected, but there's RNA detected everywhere. There is a lot of thought that the virus will die off even before it gets to the sewage treatment plant. And so right now there's not, with the current understanding and current recommendations, there's not a thought that there's really, an increased risk at this point.
Any research on titanium dioxide nanoparticle coatings with natural UV activation?
Yeah, there's been a lot of discussion about nanoparticles and their usefulness. They're on our radar to take a look at. I think the thing about nanoparticles is that they're really a hot research topic, right? They've been a hot research topic for, I don't know, at least the last 20 years, in that they can promise to really do some really fantastic things. But really there's very few, if any, products out there that are employing nanoparticles. And partly I think it's because of some of the safety concerns and things like that. But the other part of it is there's such a very tight band of particle size that's needed to actually create these nanoparticles that, there's a cost there. There's a real cost in trying to generate these products. We are going to be taking a look at at least one or two of these sort of experimental products, if you will, just to see what kind of impact they do have. Because obviously, if they do, and they are an enormous part of the solution, then cost becomes a little bit less of a factor in some way, right? So we are going to take a look at them, but on the other side of it, there's not a lot of them that are out there right now either.
Is EPA testing SARS-CoV-2 only, or are surrogates added to the experimental matrix? If so, which ones?
Yeah, great question too. Surrogates are added to the matrix, and it's a number of different surrogates. I think the registration surrogate is a human coronavirus 229E. That's the one that's being used by our Office of Pesticide Programs for registration testing. We're using a number of different surrogates, or considering to use a number of different surrogates, coronavirus surrogates, one being a mouse hepatitis virus. And so part of the reason of using a surrogate, right, is to be able to test the product at a lower biosafety level. So at a lower biosafety level, if we can get out of the BSL-3, which is currently required for SARS-CoV-2, if we can get out of the BSL-3, we can do things at a lot more scaled up, right? So we can do a lot more application studies. When we're applying the electrostatic sprayer, for example, it's better if we can apply it in a larger area and see how well does it work. How well does it get these hard to reach places? Or if we're doing the UV light study, it's better if we can have like a mock subway car or a mock facility room and see, well, what's happening underneath desks or chairs or in the carpet, or where the lights maybe have a little bit harder time to reach. So the scale up is important. So when we try to figure out what type of surrogate we're looking at, we're trying to figure out, what would also be appropriate to get outside of this really tight biosafety level control and being able to do. So we are still considering other viruses. 5.6 is a bacteriophage, so it's a virus that infects bacteria and not humans. And so we've been using that as a potential surrogate. Of course, we don't have data right now against SARS-CoV-2, but we will have data against SARS-CoV-2 to see how well it compares, as well as that mouse hepatitis virus I mentioned, as well as some other human coronaviruses. So long-winded answer, there's still a lot. There's a lot of different surrogates being tested, both coronaviruses, other coronaviruses, and viruses that are non-coronaviruses, to try to have a range of, sort of approved, if you will, or at least verified surrogates for the different types of needs that are out there.
Is there a concern that these solutions may affect water quality if discharged via stormwater runoff or through WWTP discharges? I
would think there absolutely could be. When we talk a lot about, so being in the Homeland Security program, until this, our largest project was actually taking a look at wide area Bacillus anthracis incident. So if somebody took Bacillus anthracis or anthrax spores and sprayed them all over a community, how would the community deal with that? And so one of the factors is, having appropriate disinfectants for this wide area use outdoors for Bacillus anthracis, but not impacting the environment. And we actually have some tests and some work ongoing related to that with the Coast Guard, looking at Coast Guard installations. And so they have issues with, one, not killing their vegetation along the coastlines and creating areas of, that could be potential subject to erosion, as well as not, putting anything in the water that's going to get us in trouble or hurt the environment at the same time. So absolutely, that is something that is considered when the choice of disinfectant, or even how disinfectants will be applied. When we worked with the Port of Oakland, one of the Diamond Princess ships, I think, was docked there, and so there was a question of how do they disinfect the pier after the passengers disembarked from the ship, and that was absolutely one of the concerns that we talked with them about, or they talked with us about, in terms of which disinfectants would be appropriate. Nothing can get into the sound. How would they apply it such that nothing gets in, and things like that. So good question, and it's something that's always on the forefront.
Can you share the test methods being used to evaluate the residual coating?
Yeah, they are not. Yes, I can share them. They're not currently publicly available. If you contact me, we can talk about it. I can get them shared. Our hope and intent is to make them publicly available. But I can absolutely just get in touch with me.
We need research on the efficacy of cleaning with soap, detergent, cleaner, and water. Are there enough viable pathogens left to warrant disinfection in the general environment?
Yeah, great question. We're doing exactly that. So part of the project I mentioned on the porous real-world surfaces. So this project, I didn't mention the entire scope, but the scope of it is looking at porous material for disinfecting. So it's also looking at just cleaning alone, and that's going to be on a couple porous materials, a couple other types of materials like Formica, and then the elevator handrail. Looking at just soap and water and what type of log reduction that you get compared to using a disinfectant, as well as maybe some other, the idea or hope is maybe some other type of detergent like tied with bleach and water. So that's absolutely a great question, and it's something that we're interested in looking at, just cleaning alone. And then the other piece to that is things that we're calling sort of, in quotes, alternative disinfectants. So things that have the active ingredients of many disinfectants that are not registered as disinfectants. So one of the concerns that a lot of stakeholders are having is that these disinfectants are becoming in short supply, especially especially the more frequently sought after ones. Just for us, if, for example, trying to get electrostatic sprayers for testing, the backlog is 2 to 3 months to get an electrostatic sprayer. And that's the same for some disinfectants we're finding. So we're looking at, in this project as well, things like pool chemicals that have free available chlorine that's similar to bleach, and how well they might work, and some other types of chemicals that we would consider, again, alternative disinfectants.
Here's a couple questions that I'm going to try to put together. Is there evidence of infection in the air, such as indoor spaces like restaurants and air conditioning units? And are gloves a secure use of protecting yourself against the infection? There's a false security, and there needs to be continued hand washing. Yeah,
so the first one about air, it's a little bit out of my area of expertise. It's a good question. I think that's the number one way that CDC says that the virus is being spread is not by surfaces, is not by everything that we talked about today, right? It's a factor and it's a way, but the number one way is with close contact with people. It's from the aerosol, from the droplets that people are exhaling, and being in close contact with them. So there is a concern about the air. It's really hard to consider, and there are folks that are considering. It's really hard to figure out how would you consider disinfecting the air while people are still in there. That's a challenge. So best ways are, there's other practices, right? And that's wearing face coverings. That's not being a close talker and having some social distancing and things like that. So yes. In terms of gloves can be effective. Obviously, they're a barrier, right? But if you touch a surface, now you have a contaminated glove, and touch your unprotected face, well, that barrier's gone, right? You just put the virus from the glove to the face. So they're helpful, right? They're a barrier, but they have to be used right. They have to be taken off right. You then have to make sure you wash your hands thoroughly to take off any contamination that might be cross-contamination, and doffing your PPE. So they are helpful, but again, I see, I'm sure you do too, see people out there driving in their car with their gloves. They go in the store, they have those same gloves on, thinking they're protecting themselves. Well, now they're going back in their car, touching the steering wheel again. You got to think about those surfaces are getting contaminated too, and you're cross-contaminating if you're not using them appropriately. There was one other piece of that, I think.
I think that covers it. We have time for one more question. There are about 20 other questions that didn't get answered. So Sean, you want to put up your contact information,
Yes,
so
absolutely.
Participants can contact you after the webinar. And I will also send Bailey the questions that did not get answered as well. So last question, I'm curious if the long-term effects and potential mutations of the virus with the microbial blocks and excessive disinfectant.
So if it's going to impact disinfectant, we're going to be doing all this over again if there's a new strain. I don't think so. This happens all the time with influenza. There's many products that are registered against influenza. Typically, the different strains will infect the virulence of the virus, but it doesn't necessarily change the difficulty in disinfecting the virus. So it's probably very unlikely that there'll be major modification of the virus such that it's impacting its disinfectant. But there's a number of strains out there currently, and there's a lot of different testing against those different strains going on currently. So hopefully, when more is known, as more information and data is getting out there, we'll see if there's any strain-dependent efficacy difference due to disinfectants. But based on what we've seen from other related viruses, it's probably not anything.
Well, we are at the hour. Sean, I would like to thank you so much for this timely presentation. Bailey and EPA, thank you as well for partnering on another wonderful presentation. I'd like to thank all the participants And we hope you found the value in this webinar today. And again, if you have questions that did not get answered, please contact Sean. And I will also send the questions in the chat box to Sean and EPA.
Well, thank you, NEHA, and thanks to everyone.
Great. Thank you, Christine. Thank you, NEHA.